Headaches are one of the most common problems with the nervous system. They affect millions of people all over the world. They can be a little annoying or really painful, and they can make it hard to do everyday things. They can also make you feel bad overall. Knowing about the different kinds of headaches, what causes them, and where they hurt on your head can help doctors figure out what's wrong and how to help. There are two main types of headaches. Primary headaches. These headaches happen on their own and aren't caused by another sickness. Migraines, tension headaches, and cluster headaches are all primary headaches. Secondary headaches. These headaches happen because of something else, like an infection, an injury, a problem with blood vessels, or a problem with the nervous system. Migraine headache. Location. Migraines usually hurt on one side of your head, but they can hurt on both sides. The pain is often near your temples, behind your eyes, or on your forehead. Symptoms: migraines can cause a really bad throbbing pain. You might be sensitive to light and sound, feel sick to your stomach and throw up. Some people see flashing lights or weird patterns before a migraine, which is called an aura. Causes and mechanism. Doctors think migraines happen because of unusual activity in the brain. This activity can affect the messages nerves send, how blood flows, and the chemicals in the brain. Things that can trigger a migraine include stress, changes in hormones, not getting enough sleep, not drinking enough water, and some foods. Tension type headache, TTH. Location. You feel tension headaches on both sides of your head. They usually go around your forehead, temples, or the back of your head. It can feel like a tight band is squeezing your head. Symptoms: tension headaches feel like pressure or tightness. They aren't usually as bad as migraines. You won't feel sick to your stomach or throw up. They can last from 30 minutes to many days. Causes and mechanism. Tension headaches happen because of tense muscles, stress, and bad posture. They're connected to how your brain feels pain. Cluster headaches cause a very bad pain on one side of the head, usually around one eye. They can feel like a burning or stabbing pain. You might also have a watery eye and a stuffy nose on the side that hurts. You might feel restless or fidgety when you have a cluster headache. These headaches happen in groups or clusters. This means you might have a lot of headaches for weeks or months, and then they go away for a while. Causes and mechanism. A part of your brain called the hypothalamus controls when you sleep and wake up. Cluster headaches are connected to the hypothalamus. Men get cluster headaches more often than women. Alcohol, strong smells, and changes in temperature can trigger them. Sinus headaches hurt around your forehead, cheeks, and nose. Your face might hurt and feel full of pressure, and your nose might be stuffy. Bending forward can make the pain worse. If you have an infection, you might also have a fever. Causes and mechanism. Sinus headaches happen when the sinuses in your face get swollen. This can happen because of infections, allergies, or changes in the weather. Cervicogenic headaches start in the back of your neck and spread to your forehead and temples. Moving your neck can make the pain worse, and your neck might feel stiff. It might be hard to turn your head. Causes and mechanism. These headaches come from problems in your neck, like arthritis, tense muscles, or pinched nerves. Rebound headaches, which are also called medication overuse headaches, can hurt all over your head. If you have a rebound headache, you might have a headache every day or almost every day. The pain is often worse in the morning. Pain medicine might make the headache go away for a little while, but it comes back when the medicine wears off. Causes and mechanism. Taking pain medicine too often, like ibuprofen, acetaminophen, or triptans, can cause rebound headaches. Your body can get used to the medicine, and you might feel sick if you stop taking it. A thunderclap headache is a very serious kind of headache. It causes a sudden, very bad pain all over your head. It's a really, really bad pain, and it happens very quickly. People sometimes say it's the worst headache they've ever had. You might also feel sick to your stomach, confused, or have blurry vision. Causes and mechanism. Thunderclap headaches can be a sign of a serious problem, like a brain aneurysm, a stroke, or bleeding in the brain. If you have a thunderclap headache, you need to go to the doctor right away. Where your headache hurts can tell us what kind of headache you have and what might be causing it. For example, if your forehead hurts, it could be a tension headache, a sinus headache, or a migraine. These can be caused by stress, sinus infections, or straining your eyes. Pain behind your eyes can be from migraines or cluster headaches. These usually happen because of changes in blood vessels or irritated nerves. If the top of your head hurts, it's usually a tension headache or a rebound headache. Stress or taking too much pain medicines can cause these. Pain in the back of your head and neck can be a cervicogenic headache or a tension headache. Bad posture or neck problems can cause these. Finally, if only one side of your head hurts, it could be a migraine or a cluster headache. These are related to how your brain works or the hypothalamus. Treatment and prevention. Let's start with changing how you live. Go to bed and wake up around the same time every day. Drink lots of water. Learning to relax can really help with stress. And don't do things you know can cause headaches, like eating certain foods, drinking alcohol, or being around bright lights. Now, let's talk about medicine. Acetaminophen and ibuprofen can help with pain. Triptans can help with migraines. Some medicines can prevent headaches, like beta blockers, antidepressants, and anti-seizure drugs. Other therapies can also help with headaches. Acupuncture is one option. Physical therapy and cognitive behavioral therapy, or CBT, can also help. In this chapter, we'll talk about the newest research on headaches and how to treat them. New studies are showing good results with new medicines and other therapies. Researchers are always looking for new ways to treat and maybe even cure different kinds of headaches. We'll keep you updated on any new discoveries. So, there are many different kinds of headaches, and they all have different causes and symptoms. Knowing where your headache hurts and what kind it is can help you treat it. If you have headaches a lot, they are really bad, or they feel different than usual, go to the doctor. The doctor can check to make sure you don't have a more serious problem.